My name is Kendra. I am one of our recruiters, of course, with Northern Light Health. I have Tracy here joining me today, and we very much appreciate you coming on and logging on to learn more about Northern Light Health and all that we have to offer. Right, Tracy?
Absolutely.
Yeah. So I do have a presentation that I'd actually like to share so you can see the colors and flavor and learn more about Northern Light Health in that way rather than just listen to us chat, though we're a ton of fun. So we will go ahead and start that. We, of course, represent Northern Light Health. Northern Light Health, we are one of the largest medical networks here in the state of Maine. We provide service across the state with a variety of locations, newly having 10 locations here statewide, and we employ about 12,000 individuals across the state. Isn't that right, Tracy?
It is, absolutely. And we're very lucky. Eastern Maine Medical Center is one of our largest member orgs. We do have 10 member organizations across the state. So we do have a large offering of different positions ranging from either clinical, non-clinical, professional, entry level. So we have a lot of opportunities for people that live in Maine and are coming from outside of Maine and want to make Maine their home.
Absolutely. Absolutely. The wonderful part about our network is that each of our hospitals still have their unique flair and what makes them them. They support the community and the individuals of that community. For example, Mercy Hospital down in Portland is specifically one of our only, or is our only, religiously based and faith-based facility. And though they don't preach that on anyone, they're a part of the Northern Light Health umbrella and network while still keeping that uniqueness that makes them special and has helped them to thrive. Once in our system and within our network, you have flexibility as an in-system candidate to go ahead and apply as your life changes and adapts and grows, so you can grow with us. We provide a variety of these services listed there in the bright green, some of our new branding colors, so to speak. Our home health and hospice, emergency transport. We have our nursing homes or retirement communities, integrated physician work, our work health, laboratories, pharmacies. So to Tracy's point, whether it's clinical or non-clinical, you'll likely be able to find a spot with us at Northern Light Health. So we have some of our top positions. Tracy, you want to go over those?
Sure. The positions that we are currently really focused our recruitment efforts in right now are, of course, nursing. We are always looking for nurses, accounting and finance, family nurse practitioners, surgical techs, CNAs, patient observers, which is, I think, a newer position that we have within the Northern Light system, physical therapists, patient access reps, LCSW, so people interested in social work, phlebotomists, medical technologists, MAs, providers of all levels. We need help in all of our cafeterias and with our nutrition services. So we're looking for dietary aides, cooks, people to help in our cafe staff. And our personnel loves the cafe staff as well because they really depend on that department as well to get through their shifts. Housekeeping, coders, patient service reps, EMTs, as Kendra had said before, part of our emergency medical transport team, pharmacists and pharmacy techs. I think one thing I'd also like to highlight is that within our 10 member organizations, our Eastern Maine Medical Center is a tertiary hospital. So it serves as really a hub for our other critical care access hospitals that are not just within Northern Light, but within the state of Maine. So one of those other positions could possibly be our LifeLight nurses and technicians.
Yes, and we always support once someone may come in, for example, in a position as a CNA, that individual and personal growth, whether it's through educational support as a full-time employee. That's one of our benefits after 6 months of employment, is you can help get that support. So we, absolutely encourage individuals to continue their professional and personal growth. once
Absolutely.
on
And patient observers is one way to come into that. If you're looking to go into start your clinical career, coming in as a patient observer and then moving to a CNA and then moving up that professional growth ladder is certainly an opportunity. Absolutely.
So the next question is, how do you apply? I have included here the Jobs in the US link for us, or that icon number for us as an organization. You can also visit our personal careers website at careers.northernlighthealth.org. You're able to isolate and search depending on whether it's those clinical or non-clinical postings. You can view based on a location, if that's most important to you, and whatever factors are influential in your job search. By creating a username and password in that profile, you can save and upload your information to make it easier to apply multiple times or to multiple positions. Additionally, you can go ahead and create what we call job alerts. And these are a push notification so that in the future, say a job isn't available now that you're interested in, but one comes available in a month or a couple weeks, you would get that, notification to your email saying, hey, look, remember Northern Light Health, you were interested in these roles and now they're here for you. So that's always a great way to keep in, touch with us and know what's going on in our organization. There we go. I'm going to flip through these. So with regard to your cover letter and resume, I have added here just some things that we have seen that we make as recommendations as you're building your resume, whether it's for us or someone else. Some of those things include choosing a format style that's really professional and reflects you. I recommend, of course, utilizing a PDF as your resume, because your format and our versions may be very different of Word when we open them up. Avoid things like clip art or pictures. You'd be really surprised at what we've seen. I've gotten resumes that have glitter graphics on them, or they have pictures of candidates in Minnie Mouse costume. So some of those are really interesting. And, just some tidbits here, especially the grammar. Unfortunately, we have seen some blunders on those resumes. People accidentally saying they speak spinach instead of Spanish. Or even I had a individual previously working for a public education system who was apparently working for a public education system, which is not what you want on your resume. So just reread, have someone else reread it with you, and really just kind of watch out for those. Big thing is not to oversell or over embellish. We will work with you, whether it's the position you're looking for today or that plan to build 5 years from now. Be confident, but choose your words wisely, and don't lie about yourself, because we'll be able to genuinely find something that fits you now, as opposed to some false statement of yourself. With regard to your application process, so you've applied and what to expect after that. Tracy and I can tell you that we actually review every resume and application personally. We don't use an algorithm like a lot of companies that maybe will accidentally spit somebody out if the right verbiage isn't on that resume. So we review them. This takes a little bit of time, typically about 4 business days by the time you have applied to when we're able to guarantee that we've reviewed that application. We will typically go over that resume, cover letter, and make sure that you've meet all the qualifications. And then should you do so, you would be extended an offer for a phone screening or a direct interview with a manager once they've had the opportunity to also review your application. And then references are the other big thing. Typically, we'll send you a request for those. And that's done electronically. So you enter in your contacts and they'll receive either text message or email notifications to go ahead and respond on your behest. All right, and we're going to go ahead and skip the interviewing. Let's see. So Tracy, I'm going to have you go over what we look for at Northern Light Health for our candidates.
I think first and foremost, beyond candidates meeting the minimum requirements of a position, a positive attitude. Somebody that is really interested in developing and showing excellent customer service skills. Everyone in our hospital is a patient, a customer, And really, at the end of the day, that is our focus, is to deliver outstanding patient care. So we're looking for candidates that feel strongly about giving that same experience, having patients really come to any one of our hospitals and have an exceptional experience. We're looking for people that are dependable, they're reliable. All of our postings show, clearly state the shift, the time. So we're looking for candidates that can fill those shifts and obligations. We depend on you to be a positive member of the team, and part of that is the team being able to depend on you and rely on you. Really taking the job and owning it. Putting your all into it. We are here to support you and help you. We want to help you grow, but we can't do that without you really taking that on and wanting to do that as well. Commitment to your coworkers really comes back to being a member of the team, being dependable and reliable. You know, when you're committed to your coworkers are committed to you. And so it makes for just a well-functioning unit or team. And again, all of that goes right back to delivering outstanding, excellent patient care. We want candidates that are motivated, have innovative ideas, you show integrity, you want to build on your skills. So all of those things really, those are really the beyond the requirements of the position that we're really looking for in terms of character for our coworkers and our employees.
Yeah. And I'll say the other thing with regard to Northern Light Health, and I think this is a great thing to wrap up on, because I know we got to get to our Q&A, is going to be that at Northern Light Health, the big focus is that community. You know, whether it's the sub-community, to Tracy's point, of the team that you work on, or within the network of your floor, your hospital, and I think just the greater community of us here in Maine. You know, we have really focused on our branding because it means true to us that Maine made me and Maine made us. We are just as much a part of this community, and we want to support the individuals that we live with, our peers, our friends, our neighbors, and let them know that they can trust us well before they ever need to come into one of our facilities for a medical emergency or for medical care. So, you know, if that's something you can get behind, even though, you know, the world sometimes feels like it's going a million miles a minute, but if you can really focus on that community and that quality of care, you may be a really great fit for Northern Light Health.
Great. Well, thank you. I think Tracy and Kendra, that was great. Very informative. Thank you again for being here.
Thank you.
Thank you, everyone.